Thousands of Americans get the COVID-19 vaccine. There is one group worried they are being overlooked, even though they live in one of the most COVID-prone environments, our country's prisons. Scripps reporter Dan Grossman spoke with one prisoner who is pleading for people to listen to inmates' concerns.
In the battle against a virus that we have only started to understand how to control,
I'm sure everybody in here is worried about it.
there is at least one man who feels like he has none.
There's not really nothing, that I can do as far as controlling it.
The only way we could speak with David Hurt is through a collect call from his prison block at the Mountain View Correctional Institute in North Carolina. He's 54, immunocompromised, and 3 months away from returning to his family after 22 years in prison.
Once one person gets in here, it's going to be a big spread.
The one thing standing in his way, he says, is a virus that has infected 1 out of every 5 prisoners in the United States and killed more than 1,700.
I'm definitely concerned as far as how the environment is in here and how things are handled.
According to the nonprofit COVID Prison Project, 14 states have listed incarcerated populations in their Phase 1 vaccine distribution plans, 23 states in Phase 2, 1 in Phase 3, while 11 states have not included incarcerated populations in their distribution plans at all.
There's a very strong connection between what's happening in these spaces and the rest of society.
Considering that COVID transmission rates are 4 times higher in prisons than the general public, the group's co-founder Lauren Brinkley Rubenstein finds it troubling at best.
Public health entities in the field of public health tends to think of correctional health as separate, as not maybe in their purview. And I think that needs changing.
Early in the pandemic, corrections and public health experts agreed that reducing prison populations was a good first step in reducing the virus's spread. Federal and state governments worked to expand programs that allowed for early release or home confinement, but only a fraction of those requests have been granted. According to the Prison Policy Initiative, our country's prison population has only risen since it was first reduced in spring.
Facilities that have lower percent capacity, so less people in them, are less prone to outbreaks.
For people like David, that means waiting and hoping more control is given to prison populations in the vaccine pecking order, as people like Lauren work towards a more unified solution. I'm Dan Grossman reporting.